and thank you for joining us for the 2024 North Carolina Medical Society Candidate Series. I'm Randy Aldridge, and as you know, we've invited all of our members who are running for state or federal office to join us here and answer some questions that you submitted that focus on healthcare. Today we have Dr. Ralph Carter, who is running for House District 48. Hi, Dr. Carter. Thanks for being with us.
Thank you for having me.
So let's talk about the first question I have for you. You're in the Laurinburg area, so I think you may understand this as well as many of our members do. There's a big gap in the state of North Carolina where in our rural areas, where we don't have enough healthcare professionals to meet the needs of the people who are living there. If you're elected legislatively, what are some of your ideas to help close that gap and get care to the people who need it the most?
Well, you're right. I am in a rural area. I've been there for over 30 years. I know the problem, and the current problem for us is that our aging surgical staff is having difficulty replacing ourselves because of the income disparities between the surgeons in the urban areas and the rural areas. So somehow the legislature or whatever entity needs to come up with some package of incentives, be that through scholarships or other enticements, to get people to come to a place like Laurinburg, because you can't have all the surgeons concentrated in urban areas. You can do telemedicine for some specialties, but if you need your appendix out, you need somebody in Laurinburg to take your appendix out. Doesn't have to be in every town, but that's 200 miles from Charlotte to Wilmington. Mm-hmm. So it's tough.
And keeping this a little bit about rural health care and moving into like Medicaid expansion, which has just happened last year. 600,000 North Carolinians now eligible for Medicaid expansion. And I think the last number said nearly 400,000 people have already applied or are getting Medicaid rather. Pretty landmark work for us here at the Medical Society. I want to know if you're happy with that and what you think the next step is.
Well, I think we'll see the end of this chapter when it's all over, but the more the government gets into healthcare, the more complicated things get and perhaps more inefficient they get. But I understand the need. I see a lot of people that don't have any insurance. I see a lot of people that are on Medicaid. I know that there are people that are on commercial insurance that are paying higher premiums because they've got a entry-level job at Campbell Soup, which is a local plant, and they may opt to go with Medicaid. Now the reimbursement to me in the hospital is actually less. So then that problem of keeping folks like me in a town like Laurinburg gets worse. However, the need for people to have coverage so they can have accessibility to care is probably paramount in this. And in that sense, I'm a fan of taking care of our population.
Let's talk about something that our members are particularly fired up about right now, and it's prior authorization. And how that can lead to ineffective treatment for patients. It's a hot button issue for our members right now. Let's talk about that and what you think about it. And again, if you're elected, is there something you think legislatively we can do to make the necessary changes to that?
The legislative answer is difficult, but I do see, even since the turn of this calendar year, the insurance carriers are more aggressive than ever. We're having to talk to people about surgeries that we used to not have to talk to them about. And they just seem to be throwing up more and more roadblocks in our way. And that causes my staff, the hospital staff, to have to increase that administrative burden that's a tax on everyone. And it does lead to less efficient, less timely care. I don't know how you rein all that in, but there's a lot of interest. There's a lot of money flowing through healthcare, and everybody wants their hand in it. I'm a little distressed that the Medicaid expansion, we'll go back to that for a second, is so tied to managed Medicare. And managed Medicare means that we're taking some of the dollars that would have gone to healthcare, and it's going to an insurance company, and their job is to squeeze that dollar, deny that physical therapy visit, deny that MRI. And so the devil is in the detail. Legislative solutions, I don't know if it'd be better to get the insurance companies out of the game or keep them in it, but that would be one place I would investigate.
Let's talk about something then that you mentioned earlier. I know there's no crystal ball with anything, but you mentioned telehealth earlier, and we are certainly entering into a new world when it comes to healthcare. There's so many things. Telehealth, there is AI, there's so many things on the horizon. Just looking forward, what do you think is going to be happening in the healthcare sphere over the next several years?
I think there will be more consultation over video link or with subspecialists. And for, again, back to the rural hospital, we're able to keep patients in our ICU that we could not keep before because we have a bunker full of intensivists that help come in and answer difficult questions about management of this or that critical problem with a ICU patient. And that means we're not having to put them on the helicopter or the ambulance and drive them to Raleigh or Charlotte or Wilmington. They'll go to Wilmington very often from my location. So that kind of thing is good. Sometimes it may increase costs. I know that we have a big problem with mental health, and our emergency room doctors used to take it upon themselves to decide if this patient needed to be involuntarily committed or whatever. And now they defer to the psychiatrist who comes in during business hours on a video screen, and it actually raises the cost and doesn't really fix things. The other problem I have, well, AI and manipulation of data quickly, all kinds of computerized systems is an advantage, but I worry about the information going in because it's a computer. What goes in is what comes out. And if you put garbage in and standardized protocols, you lose that one-on-one doctor-to-patient judgment, and we end up with a cookbook. So that's a bit of a problem, especially when we have this huge influence of pharma driving those protocols.
It's a whole new world with all of this technology. We just have a little bit of time left. When it comes to your campaign, what are your main points that you want everybody to know?
Well, I think that rural districts like mine, poor districts like mine, used to not be poor. We had industry down there. When I moved, there was more Fortune 500 companies there per capita than any county in the country. All that industry's gone, first to Latin America, then to China. So we need economic development. We don't have beaches. We don't have golf resorts. So our taxes are higher than they are anywhere else. So it's a crazy world. So some equalization of that. North Carolina is growing. Some mechanism to help us grow. If we get economic development, it helps that whole medical question. People have jobs, and that solves that disparity of care issue.
Mm-hmm.
So we need to grow.
All right. Thanks for talking with us. If people want more information about your campaign, how can they find it?
We have a website, ralphcarterforhouse.com.
All right. Thanks so much for being here. We'll have all this, of course, on our website. And thanks again for joining us for the 2024 Candidate Series. I'm Randy Aldridge.